Oh, did you know we're in the middle of a pandemic and people are concerned, obviously, a lot about the coronavirus. Now, flu season is going to be coming, setting up that potential for a double whammy. How concerned are doctors about the flu? We've been talking about it here a lot, trying to get you prepared so you don't worry. There's nothing to be worried about. It doesn't do you any good. Joining me live from downtown is Dr. Cole Beeler, as an infectious disease specialist with IU Health. Good morning to you. And I say you can't be worried because worrying doesn't do you any good. Right?
Yep.
You've got to do something about it. So let's talk about this flu season and how do you think, how worried, though, I use that word as you know I'm using it, how worried are you?
I'm pretty worried about it, to be honest with you. I think that things are so tenuous with COVID that any extra utilization of hospital resources, any extra infections that mimic COVID could put stress on systems that we need. So I'm taking it very seriously, as are our healthcare systems.
Okay, and we're going to do something about it. We're going to have a plan. We're going to be prepared so we don't have to actually sit and worry, as we know I'm joking about. But when should someone get a flu shot? We hear different times it's good for maybe 6 months. Maybe it's more like 3. What do you say and what are you suggesting right now?
Yeah, so the immunity does go away with time. And any other flu season, I would typically recommend maybe mid to late October. But this year, I'm a little bit more pragmatic about it. I think that get it when you can get it as soon as possible. I think September is very reasonable to start getting it. Whenever you have a free time to get the flu shot, it's about that time to start thinking about it.
How are people going to know the difference? Without just getting maybe a COVID test. I mean, all of a sudden you're going to start feeling really crummy. Maybe you have a fever and you're thinking, gosh, is this COVID? Is it the flu? What are you going to suggest that people do?
Yeah, that's the tricky thing, even for us physicians, is that you can't really tell them apart. The syndromes completely overlap. So short of getting a test, there's really not a great way, just based on the symptoms that you have, to tell if you've got flu or COVID. So in general, the processes for control are about the same. With flu and with COVID, you want to make sure that you isolate yourself until you're feeling better, probably for at least 10 days this year.
Okay, that's maybe the key here, is that 10 days. We're normally, maybe even after maybe 4 or 5, we didn't have a fever, we might go back to work or school. A lot of schools are saying, hey, don't come back for, they're having their own amount of days. So you're saying 10 days probably if you have the flu now, or if you don't have that test to determine which it is.
Yeah, I mean, we want to be able to test as many people as possible to tell people if you have COVID or if you have influenza. We're working on that locally. But in people who don't get that differentiation for you have one versus the other, I think it's prudent to treat all of these syndromes like they're COVID and wait that 10-day infectivity period before you start being exposed to other people.
We're going to run out of time quickly. When you do get this vaccine, there are 2 different ones. And a lot of times we hear there's a different effective rate. What do you want people to know about the different vaccines?
So there's probably like 5, 6 different vaccines actually, but in general they have 3 to 4 strains of the virus. In any given year, the success rate for the vaccine or effective rate is 40 to 60%. That's actually pretty good. You wouldn't drive without a seatbelt while you're driving, and that probably has that same about success rate. So it's still very worth getting and making sure that you use it not only for you, but to protect your loved ones around.
I'm going to get one for the first time in several years this year. Dr. Beeler, thank you so much. Good to see you.
Yes, nice to see you.